Hi class! I chose ADHD as my presentation because my little brother has it, so I wanted to learn some more about it. So for the overview, ADHD is described as a attention deficit hyperactivity disorder. These are two separate things, and some people will either have one or the other, but it's most commonly both in ADHD. It's commonly found in children. They are usually found about 3 to 6 years old, and it hinders children in learning and in multiple aspects of life. This could be in school, listening to other people, it causes problems in the family, and we can learn some more about it. So, the history is that British pediatrician found it in 1902. His name was Sir George, and he also mentioned that even though they had the disorder, that they were still intelligent. It just meant that they had no self-control. Then later on in the 1930s, Dr. Charles Bradley discovered that Benzedrine had positive effects to the patients. This wasn't such a large breakthrough when it happened, but later on the community recognized that it was significant. Then later on in the 1950s, APA released the first Diagnostic and Statistical Manual of Mental Disorders, DSM. They left it out. But then in the 1980s, it was founded as a hyperkinetic disorder, and then they changed it to ADD. But now it's currently known as ADHD. So the reality of ADHD is that it's a psychiatric disorder that impairs mental functioning, and it's a valid condition because it affects people's behaviors and their reactions. It commonly affects their concentration and impulsivity. The symptoms are struggling to stay put or having an immense amount of energy. I found that on Child Mind Institute as long as all the other data. Constant fidgeting, running around and climbing on things, being easily distracted and making careless mistakes, having a difficult time staying organized are some of the few symptoms. They could also seem inattentive or seem unaware of what's going on around them. So sadly, there isn't a cure to ADHD, and it doesn't currently exist, but there are some treatment options that includes lots of different types of therapy or medication. And it also can't be prevented, only methods to cope with it. So some academic accommodations, according to Centers for Disease Control and Prevention, longer time on tests can be provided, specific assistance and instruction to the child, and positive reinforcement and more attentiveness to engage the student. These things are all necessary to help them stay focused and to cater to them. They could also make specific assignments for them, and positive reinforcement is good for them. And also using technology to accommodate has been helpful. Some non-academic accommodations would be to allow breaks or special chairs for them. This could be chairs that have wiggles on them, or they could have a standing desk, or even resistance bands on the chair. This makes it so children with ADHD can focus on that, but at the same time they're more focused on their work since they're being preoccupied. They may also get preference as to where they sit. That could be mentally stimulating for them. They also may frequently change environment to limit distraction, or they can get extra help with how to be more organized. Excuse me. Oh, they may also get reduced homework too. Oh, but that would be academic. Okay, so for the family point of view, this disability affects families because children with ADHD tend to overreact. This was definitely a thing at my house. It was hard to have conversations with him, or he just wouldn't listen. So that's common for children with ADHD. It's hard for them to deal with things since they get really fixated, like whatever makes them happy. So if you tell them to stop or anything, they tend to overreact. It's also a stressful situation to deal with them because children with ADHD tend to engage in risky behaviors, which becomes very stressful for the family. Lots of tantrums too. Preschool students with ADHD. So a normal classroom would be to get clear and cohesive tasks assigned, so just more deliberate assignments, make it very clear for the child to understand what they have to do. Outside, they should be supervised since they are known for running, jumping, climbing things. They're known to be daredevils. However, children with ADHD do well outside since nature keeps them stimulated constantly, since things are constantly moving around them. Some interesting statistics I found is that it's mostly in males get diagnosed more than females. The ages could be about 3 to 5. And it also gave me more attention to the beneficial resources and made me more aware of his condition because I want to be more patient and understanding with my little brother, and it helped me learn a lot more about his disorder. Thank you. These are my citations.